One of the world's most exclusive holiday destinations, the Maldives, is now grappling with a surge in COVID-19 cases. Nearly 1,400 new cases were recorded by the island nation on Tuesday, hovering near a record high. That's compared with less than 100 daily cases reported just 1 month ago. Last week, the Maldives decided to temporarily ban travel from several South Asian countries as the region faces a massive second wave. Tourists from other countries with a negative PCR test may still visit the Maldives' famed resorts, but they are not allowed contact with the local population. And joining me for more now is the Minister of State for Health in the Maldives and Acting Director General of Health Services, Dr. Shah Mahir. Thank you for your time, Dr. Mahir. What is behind this sudden surge in coronavirus infections in the Maldives?
Thank you very much. We are in the process of evaluating this sudden surge. There are a number of factors we believe is responsible for the current surge. One is there are new variants that we are concerned about, and currently we are under investigation which variants there are. And also recently because of Ramadan and a lot of movements have been happening the measures are a little bit relaxed for various reasons, so that may have had an influence on that. So for us, the actual cause for the third wave that we have in Maldives is not entirely clear. But what we've noticed is from January, at the beginning of COVID, after a year, we've had a 20% increase in cases recently. So the numbers are, as you know, roughly we have a population of 600,000 people in Maldives, and every day we have 1,400 to 500 cases being positive right now. So we have introduced some measures to control the situation.
Right. You talked about variants. Is the widely circulating Indian variant one of the variants you're looking at?
Well, India being our closest neighbor, any effect in India, we will obviously be cautious on that. So we have not identified any particular variant. From time to time, we do send for genomic sequencing. Maldives don't have the capacity to analyze the genetic variants. So we do the PCR testing, and when we suspect, we send samples. So we are currently waiting for that information. But our regulation and the way we're working, we are assuming that there is a possibility that we may have variants, Indian variants in our community, and may be responsible for this surge.
Right. Where are you with the status of vaccinations? I mean, last we heard roughly 60% of the population had received at least one shot of a vaccine. I'm wondering if you think that this is a vaccine-resistant variant you're dealing with.
Well, you're right. We are actually very fortunate to have a large number of our population vaccinated. In fact, our eligible population, 69% is vaccinated with first dose. Over 33% is vaccinated with second dose, completed the vaccination. We don't actually believe that there is that resistance, but that actual data remain to be seen. We believe the surge is to do with more of movement happening within the Maldives, as well as that additional variants might be circulating in the population. But there is no evidence to show that the vaccines are ineffective to the new cases. What we have actually seen is also the cases that are being admitted to hospitals. The people are more severe is the people who hasn't had the vaccination.
Right.
So that there is protection, and people, they are less severe when they get the disease, if those who have had vaccination, and those who have died, majority of them have not received the vaccination.
Right. Dr. Shah Mahir, the Minister of State for Health for the Maldives. Thank you so much, sir, for your time.
Thank you very much. My pleasure.